Hi, my name is Dr. Jasleen Chhatwal. I'm a psychiatrist by training, and we're talking today about anxiety in Friday Facts. Thank you for joining me. Anxiety can be many different things, as we discussed last week. For generalized anxiety or panic disorder, or any other longer standing anxiety disorder, typically there can be a couple of different ways to approach it. We can approach the condition just with therapy, just with medications, or a combination of the two. That decision of whether we do monotherapy with medications therapy or dual therapy with medications as well as psychotherapy is usually determined by the severity of the condition, how much it's impairing an individual, and what else may be going on at the time. Typically, it's good to get evaluated by a physician psychiatrist and get a good handle on what the severity of the condition is and what type of treatment plan would be best to follow at that time. When anxiety is mild to moderate, which means that it starts to become noticeable for you but hasn't gone to the point of impairing you from doing the things that you're doing in your life, whether that be school, work, engaging in your relationships, that can be a good point to start considering therapy, because therapy really is essentially like learning to ride a bicycle. It's learning a new skill, learning a new way of thinking. And the sooner we can start engaging in it, the more it helps us get to a point where we may be ready when a more severe condition shows up or when we have a stressful event. So if at all you're in your life and you generally feel like you may be a bit of an anxious person, you're a worrier, you tend to go to that place of doom and gloom a little bit quicker than other people that you know, therapy may be helpful just to start to develop a broader understanding of your own reactions, of being able to see how you react, how you think in certain circumstances, and start to give you what we call awareness around your own physiological as well as mind-body reactions, so that you can start to have greater control of any type of anxiety that you may deal with. Anxiety disorder treatments or anxiety condition treatments can come in various modalities, as we've been talking. So the treatment response really depends on the modality that's being used. If you were to be dealing with a moderate to severe anxiety condition and needing medications that are a bit of a longer term solution, most of those medications that come in classes of serotonergic medications like SSRIs, SNRIs, NDRIs, SMSs, we like our acronyms in psychiatry. So all of those medications typically start to have some effect at about 2 weeks. And then it's usually at the 4 to 6 week mark that they can truly start to show effect and you can start to feel the benefits. So it is a little bit of a long game there. There are some medications that can be used in the short term, or even very excellent supplements that have good benefit that can be used in the short term, more to ease acute anxiety and help start to feel some benefit from treatment so that you feel motivated in treatment. And then when it comes to therapy modalities, most therapy modalities are skill-based modalities and help you, one, develop behaviors that are a little bit different and may reduce anxiety, help you develop thought processes that look at these worrying thoughts or thoughts that evoke panic and distress in a different manner. And those are usually slightly longer term solutions. So there's no therapy that's a quick fix. And you want to try and engage in therapy on a consistent basis. One of the things that I would say is that sometimes when we engage in treatment, we may develop awareness a little bit sooner than we start to feel the effects of the treatment. So for some individual, it happens that when they start treatment, either with a therapist or a psychiatrist, that they may notice that because they're more aware of what's going on and the issues they're dealing with, that things start to feel a little bit harder before they feel better. And I would just encourage you to please stick with it. Find somebody who helps support you through the process, because treatment is important. It helps make your life a lot better. And I hope that you can get through the slight hump that comes at the beginning of treatment. Thank you so much for tuning in today. to Friday Facts, where we spoke about anxiety and I answered some questions around anxiety. If you have more questions, please type them below in the chat. And I look forward to having you visit with me again. Thank you so much for joining me. Bye-bye.